This is Mariah. She is my new med student for the next 6 weeks. So we're going to do some manipulations on her because she's seen me do it a few times this week and she's probably not really sure what I'm doing. So that way she can kind of gain a better understanding of what I'm doing. So looking at her, I can see that this shoulder is actually sitting up higher than this one. So that makes me concerned. Is something going on here? So I feel in her first ribs, and generally I just feel that she's got a trapezius tightness. Your trapezius is a muscle that kind of runs down here and kind of fans out. And so a lot of people have pain up in here. And so if you kind of do some palpation down and you find multiple tender points, you know that it's the trapezius. But again, I'm always looking at that first rib and seeing if there's a problem there. So then I'm finding her spinous process. So this little, you've kind of felt how that kind of went down on your back, Mariah. Mm-hmm. This is that gutter space I was talking about where your transverse processes are. Mm-hmm. So that's what I'm feeling. Okay. So I'm walking down, okay? And then I'm gonna feel at her iliac crust, find your PSIS, which is these little knobby points right here. Mm-hmm. And then you're gonna bend forward like you're gonna touch your toes. So I'm doing a stand inflection and I see that her hip on her left is having a problem here. Go ahead and stand up and then you're gonna lay on your back.
Oh my baby. This is medical school, guys.
Good, so right there. So then we're gonna feel on the ASI. So it's these little knobby things right here, okay? And so this one's actually lower than this side. And so, you guys haven't seen this in a while. Mm-hmm. So I'm gonna bend here. And so this is what you were doing earlier. So I'm feeling under your back here. Okay. And it gets harder right there. Like, do you feel that? Like how you can actually feel my fingers more? Mm-hmm. That's what I'm feeling for. Okay. So you're gonna try and push against me and straighten out your bottom, your leg is on my shoulder, like that. And relax. Try and push your knee into my shoulder. There you go. Good, relax. Okay, go ahead and push again. And stop. Okay, down. That seems like that's better. And so sometimes you'll see me do this and I'm just feeling movement of the hips to see do they move the same. The other thing I'm looking at is rotation of your feet. Scoot up just actually a little bit. Okay, here we go.
I want this.
So feeling rotation. That feels good. Okay, I'm gonna have you bend here. So you've seen me do this a couple times. Yeah. This is kind of just like a shotgun approach to the pelvis. So go ahead and push your knees in together. Good. Did you hear that little pop? Mm-hmm. That was your pelvis. Go ahead and pull apart. Good. In again. And then go ahead and pull apart. Good. This side actually feels a little bit weaker than this side. Yeah, see if you can feel it again. Okay, push in. Okay. And then go ahead and pull apart. Do you feel that?
Yeah.
Yeah, it's a tad weaker on this side. Okay, I'm gonna grab your glasses on. I want to feel this first rib that we were feeling. You can let your legs go straight. Come a little bit closer to me this way. Good. So you've seen me move a person's neck. So I'm checking rotation like this. Mm-hmm. And then we're checking side bending. And then when I'm doing translation, this is what you hear me talk about, but you can't really see.
Yeah.
So spinous process, in the little transverse process, and I am literally pushing. Feel that?
Yeah.
That actually feels good. I don't think there's anything going on with your neck. This, on the other hand, is a different story.
Yeah, I feel it.
You've definitely got a first rib elevated here. So give me this arm and bring it up. There, I want you to try and pull your arm against me that way. So go ahead and pull. Good. Stop. Go ahead and pull again. And stop. And then pull again. Good. Okay. Arm back down. So that's a bit better. Okay, go ahead and shrug your shoulder up for me. And relax. So when I can't get a first rib treated the first way I was doing it, I do what's called HVLA, high velocity, low amplitude. Okay. So I have you shrug up to kind of localize under my thumb and then kind of shove down hard when you relax. Okay. Because if you are all like tensed up, it's not going to work. But how's that feel now?
Feels better.
Good. Okay. Turn over onto your stomach for me. Were you having any pain?
I wasn't having any pain.
Okay.
I know I'm stressed.
You're a med student. You guys are all stressed.
When you press down here, I'm like, ooh.
Okay. So let's feel on back here. And this is more kind of just tight muscle. Nothing real super abnormal. You got some tight muscles, Mara. Let's look at your sacrum. You actually have an issue in your sacrum. Lay on this side.
On which side?
Yep. Towards no, this way. This way towards me. You have a torsion. What I call a torsion in your sacrum. So we're gonna bend your legs. Bend. There. Okay. Go ahead and pull your feet down to the table. And stop. Push down again. Good. Relax. One more. Good. All right. Go back onto your stomach for me. Okay. Good. Sacrum is real important. So a lot of people have back issues. It's in the hips and it's in the sacrum, and it's not always necessarily the back. So you gotta check everything. There. That's good. Okay, go ahead and stand up and see how that feels.
I feel like.
And what's funny is most people say that. You hear people stand up, they're like, I feel taller, or I
Yeah,
feel light.
yeah.
I don't know what it is about manipulations, but that's just kind of how people feel. So